I'm going to cover include just a timeline of events, some of the statistics around the state of where COVID's at and where we see it going, testing, treatments, and then what probably everybody is most excited about is the vaccination process and different types of vaccine that's available. So just walking through some of the timeline of events, we're over a year now in talking and dealing with the pandemic. January 21st is when that was the first time that we had a confirmed case in the United States. Just about 11 days later is when we had the first death associated with COVID. Today is actually an anniversary day, so interesting statistic. The virus was officially named COVID-19 1 year ago today. And then moving forward, March 19th was when all the Arkansas schools closed and all the parents, we can still hear them screaming about that day. All right, looking at the stats, this is a graph of the state of Arkansas. The orange line is the total number of active cases in the state. The pink line is the total number of patients that are hospitalized in the state. As you can see, we've steadily grown through this pandemic, reaching which would be basically a peak for the hospitals and active number of states in the case the first week in January. I will tell you that those weeks leading up to that first week in January, around Christmas, Thanksgiving, it was very, very tight in every hospital around the state. It is still very busy with the hospitals around the state, but we are seeing a pretty significant decline both in active cases as well as hospitalized patients. The green line down here, this represents just Baptist Health inpatients that we had throughout the pandemic. So as you see, we also have seen a similar curve with our hospitalized patients trending down as well. This was as of Monday. So we have as part of Baptist Health, we have a COVID call for our system 3 days a week. Early on in the pandemic, we did it 7 days a week, but we've moved it to 3 now. One of the things that we look at is where are all of the inpatient COVID cases around the state? What's the top 10? Little Rock Baptist has remained the front runner pretty much the entire way through the pandemic, getting up to a high of 130 patients that were inpatients with COVID inside the Little Rock Baptist Hospital. St. Vincent in Little Rock is as of Monday. These are stats as of Monday, so they may be slightly different today, but as of Monday, Little Rock had 88, St. Vincent 54, St. Michael's is down in Texarkana, they had 50, North Little Rock 49, UMS 44. Our Baptist Health Fort Smith Hospital, or if you recall it as Sparks, has 41. Jonesboro's been a very kind of a hot spot through the pandemic. They've had a large number of cases, but they've been trending down pretty significantly here lately, but they've got 40. Comma Regional was at 37 on Monday. Fort Smith, Mercy at 30, and then Hot Springs at 22. I'll tell you on Monday here at Conway Baptist, although we've been very busy, our COVID numbers have been relatively low. I think we only had 11 on Monday. So a couple of different testing standards that become pretty common in the public now. Very early on in the pandemic, this was one of our biggest issues, was testing and getting tests back in a timely manner, because when this started, we didn't have any machines in the state that could run these tests to even identify and diagnose it. Now, this is something that's very readily available. Most all clinics and hospitals have very good access to testing. So there's two main types of COVID tests that you'll hear about. The first one I'm going to talk to you about is the antigen test. It's also referred to as the rapid test. It's the most common that maybe your primary care clinic or one of these urgent care clinics in town would have in their clinic. And it's just a little desktop machine, and it can, with a nose swab, within about 15 minutes, can diagnose whether or not you have COVID or not. Next, we have the PCR machines. This is considered more of the gold standard when it comes to sensitivity and specificity of diagnosing COVID. Turnaround time typically is a little bit longer with these, and these are going to be inside of your hospitals. You see a few examples: Genmark, Panther, BioFire is another name. These are the instruments, the devices that what they're called that we actually own that are in our lab. So PCRs are typically reserved more for your hospitals. They're going to have that equipment, whereas the antigen testing is typically in more of your primary care clinics. The big difference between the two, an antigen test is it's a good option to have, but it's just not as sensitive as a PCR test. You're going to get more false positives or false negatives with an antigen test as compared to a PCR test. And we'll talk a little bit more about this in our testing center that we have set up here shortly. So outpatient testing. So this is specific just for Baptist Health here in Conway, but we have these sites all across the state at most all of our larger Baptist hospitals. We have a COVID testing drive-through that's located right behind the hospital. If you pull up to the hospital and go around to the back, you'll see signage that will direct you in to this area. We've sectioned off a parking lot that's dedicated just for doing COVID testing. All of the tests that we're doing through this process is the PCR test. So we swab these in the parking lot, and then they get brought inside the hospital to be ran. I have on here that says results within 24 hours. I'll tell you, it's taken about 6 to 7 hours is our average turnaround time for a PCR test. And if you come through this process or have a friend that comes through it, it's open Monday through Friday, 7 to 3:30. No appointments required, no referral is needed. You just show up. So it's an available service to the community, and we do not take any payment other than we will bill your insurance, but there's no co-insurance or co-payment that you're going to have to pay for it. So we just take whatever the insurance pays us, and there's no balance billing to the individual. If you do not have insurance, we have funds that have been made available through the CARES Act that we would tap into for that. So nobody's turned away. You don't have to have insurance, and nobody's charged a bill for this service. So if you end up with one of the unfortunate individuals and you become positive, not every COVID positive patient needs to come to the ER or needs to be hospitalized. But there are treatments available to patients on an outpatient basis that are not as widely known probably in the community. So what those are is they're called monoclonal antibody infusions that can be done. We have an infusion center in Little Rock, and then we also do these inside of our ER here at Baptist. And what it does is we're infusing a laboratory-made protein that helps your immune system fight and fight the virus off. The criteria in order to receive this type of monoclonal antibody therapy is we have to catch it very early on. So if you get a positive test, say you go through our drive-through center and you get a positive test and your symptoms are relatively new within a few days, your test is within a few days, then you're in that window. So as you can see here, the criteria on the second bullet, you need to be positive for less than 3 days and symptom onset less than 7 days. And what that means is if we don't start this therapy early on, the virus is already spread throughout your body to a point where we're not going to be able to fight it off at that point. So it's not clinically recommended for individuals that have been dealing with this for longer than those time frames. What you'd want to do is just talk to your primary care physician. If you do become positive, you just want to talk to them about, is this an option for you? Typically, this is going to be for individuals that have high risk, that we're concerned about, that as the virus spreads and progresses, that you're at a high risk. So say you're diabetic, you have other comorbidities, COPD, CHF, that would cause issues if you were to get the virus. So those are the typical types of patients that we would utilize this monoclonal antibody for. Your primary care physician will send us a referral to the ER, and then you would then be scheduled to come up to the ER to receive this therapy. It takes about 2 hours to get the infusion. If you end up progressing and needing to be hospitalized, so I want to talk a little bit about some of the treatments that happen once you are placed inside the hospital. So for most patients, we're just doing symptom management. Most patients are not requiring a higher level of intervention that I'll go into in just a minute. But we do want to keep a very close eye on your oxygen levels, your heart rate, your blood pressure. And then also some patients are also, we go ahead and start them on an antibiotic to treat them for other illnesses that can kind of spin off from the COVID-19 virus, such as pneumonia. So one of the things that we've learned with COVID-19 is patients can turn very quickly. So in high-risk patients, your doctor may want you to be hospitalized if you're having pretty severe symptoms, just for monitoring, because you can turn and get sick very quickly if you have a lot of those underlying comorbidities that we're concerned about. So that's the typical treatment, is just symptom management, watching, making sure that we stay on top of any issues that come up. You've probably heard in the news for Arkansas, one of the main treatment regimens for patients that are requiring hospitalization, have a lot of those comorbidities, and are having very severe symptoms, requiring heavy oxygenation. And I would say most all of our patients that enter the ICU are considered to receive remdesivir. So that is a antiviral medication that interrupts the production of the virus. It prevents the virus from spreading and multiplying throughout your body. So this is another one. You want to do it relatively early on, before a patient has been placed on ventilator, to try to keep it from multiplying and really taking over your system. Usually whenever we give remdesivir, we also are giving convalescent plasma to those patients. This is a blood that is being given from patients, taken from patients who have recovered from COVID. So we take those antibodies, and those antibodies are then infused into the patients to help boost their ability to help fight the virus. So usually that combination of remdesivir and convalescent plasma is the treatment regimen that we would do for patients that have a lot of those underlying comorbidities and and the disease is progressing pretty rapidly with them, and if they require ICU level care. So moving on to the vaccine, I have a picture here. This is actually the very first vial that we received here in Faulkner County. We thought it was important to document that moment, and so we took a picture of that very first vial. We were really excited to get it. I want to talk a little bit about the distribution that the state of Arkansas has received, and it's been slow. We've not gotten doses as quick as we would like, or as fast as folks that want the vaccine we can get. So right now there's two different vaccines available. The first one I'm going to talk about is Moderna. So the Moderna vaccine is being directed to long-term care facilities and then the local retail pharmacies. Over the last month, the state of Arkansas has been getting about 17,000 doses of Moderna on a weekly basis. Those 17,000 doses are broken up and sent throughout the entire state. Most of the pharmacies are getting approximately 100 doses per week. I think there's 5 or 6 pharmacies here in the Conway community that are receiving that 100 doses per week. So the local retail pharmacies are only getting 500 to 600 doses here in Conway per week. There's a pharmacy in Bologna, Mayflower, Greenbrier as well that are receiving their allotment. So they take up that 17,000 and they're spreading it throughout the entire state. And then they also directly send some to nursing homes and long-term care facilities for the Moderna vaccine. The Moderna vaccine, although it does require to be refrigerated at freezing temperatures, it does not require what's called an ultra cold freezer. The Pfizer dose does require what's called an ultra cold freezer. So we had to buy, hospitals throughout the state purchased, not all, but most of your larger ones purchased these ultra cold freezers because the Pfizer vaccine has to be kept at -70 degrees. So it's very, very, very cold. It takes a special refrigerator to store those. And as you would imagine, those refrigerators are quite expensive. So it's not feasible for all the pharmacies around the state to have those. So that's why they're directing Moderna to the local pharmacies, and Pfizer is getting sent to the hospitals. On the Pfizer side, we're getting about 19,000 doses a week, and those doses are broke up and then sent to mainly here the last month, just to the major larger size hospitals around the state. So here the last month or so, Conway Regional has been getting roughly 1,000 doses a week, and Baptist here in Conway have been roughly getting 1,000 doses a week. So a lot more doses, as you can see, are coming into the hospitals from a Conway community standpoint versus the local pharmacies at the current distribution levels. Hopefully, as production increases, these numbers, 17 and 19,000, will increase to the state of Arkansas. But over the last month, we've not seen anything change. Just so you know, so hospitals, we find out at Friday at about 11 o'clock is typically when we find out if we're going to receive a shipment and how much. So there's a lot of planning that's going on Friday afternoons. Once we all learn, a lot of communication back and forth with Conway Regional and our hospital in identifying and figuring out, who they're going to work on dosing versus who we are, what days they're going to set up their clinic versus days that we are. So a lot of work's happened on Friday afternoon. We wish that we had found that out earlier in the week so that planning would be better. But unfortunately, that's just the distribution time that the state's receiving, the fastest that they can let us know. So a little helpful tip for this group is just keep that date in mind. I don't anticipate it's going to be changing anytime soon. If you're trying to sign up either on the Baptist website or through one of these other pathways, typically Friday is the day that we go in, at least it has been for the last 6 weeks, and we open up all the new scheduling slots for people that qualify for the vaccine to start getting it. So if you get on Friday afternoon or Saturday morning, you stand a very good chance to be on the list. But what we've seen is typically by about Monday or Tuesday, all those slots, if we open 1,000, they're typically getting filled just over the weekend with little to no advertisement of it. And then also Johnson & Johnson and AstraZeneca are two other companies that are close to coming to market. So y'all probably heard in the news, the Johnson & Johnson is the single dose vaccine. So when that one comes to market here, what we're hearing likely here in the next 3 to 4 weeks, once they go through the approval process, that will be a single dose vaccine. They've not put out all of the how effective the new Johnson & Johnson is. I don't think it's going to be as effective as Pfizer or Moderna from early things that we're hearing, but it's still going to be, very, very effective. Pfizer, once you've had both the doses, it's well over 90% effective, as well as Moderna. So that's really, really impressive from a vaccine standpoint, considering your regular flu vaccine is, if they get 50-60%, they're really proud of the coverage rate on it. So very, very high effective rate for these vaccines. So coming into the state right now, so to date, the state has received 610,000 doses of vaccine, and roughly 400,000 have been given. Some of this is just due to timing. When they put out these reports, it takes a little while. Once we get the dose, you have to set up these to do a mass vaccination clinic. It takes some planning, and it's just not feasible to start giving it out as soon as we get the dose. But we do give out the doses the same week that we receive them. That's one of the things that we've been we're working really hard on, because that's how they look to see about distributing the vaccine out to various different hospitals is how effective are you at giving it out? So if here at Conway Baptist, if we want to continue to receive weekly allotments of the 1,000 or potentially even more doses a week, then we've got to give every bit of our vaccine so that the Department of Health knows that they can have confidence that if they give us the vaccine, that they can count on it to be given to the community. It's been very difficult for some institutions, whether it's a local pharmacy or even some hospitals, uh, due to resources, just to be able to give the number of doses. So if they're not effective in being able to give them out, and someone else is much better at doing it, that's where they're going to send it. So we work really hard to make sure we use all the doses that we're given, so that we'll keep getting a steady flow coming in. So we're currently still in the 1B phase that the governor has placed. So that's anyone over 70 years old, as well as the educators, K through 12, childcare workers, higher ed. Really proud over the last few weeks, in collaboration with the city of Conway, fire department, police department, Conway Regional, all the school leadership from K through 12 all the way up through higher ed. We collaborate on a weekly call. So we have a planning call. It's been led by the city over the last, probably 2 months, in planning in preparation for how we want to address these different groups. And so for example, last week we decided that Conway Regional would do higher ed. So they just focused their 1,000 doses that they received and coordinated and got all the higher ed completed. The local retail pharmacies were able to secure an extra 700 doses from the state last week, and they planned and they focused and did K through 12 at the McGee Center. And then here at Conway Baptist, we took our 1,000 doses and just focused on the 70 plus population. So that's some of just the coordination that's going on to ensure that we effectively take care of each of these groups. As the governor continues to open the different phases and the different groups, that planning group will take that same approach in coordinating to make sure that we very quickly and swiftly address each group that is coming up. So to talk just a little bit about our vaccine process here at Baptist Health. For those that are eligible, we are using it. We've had to to be able to do 1,000 people in a week. It's got to be a very efficient process. We had to eliminate paper. The first few weeks we did it all paper, and it was all manual. Every vaccine that we do, there is required paperwork that has to be given to the individual receiving the vaccine. If people on here, you've received the vaccine, you've probably got the little fact sheet about what vaccine you got and all the potential side effects that can come up. And so we have to give that to individuals, but we also have to have you sign a consent form acknowledging the risk. And that's true with any vaccine that you would ever get. So we have automated this process. It's all within MyChart. That's our electronic health record that we use. And so all of this is now done electronically. It's how we can send you reminders of when your second shot is due and where it's due. So in order to sign up for a vaccine when you're eligible, all you have to do is go to baptisthealth.com, just the main site. And right at the top of the Baptist Health page, there's a big yellow banner. It says COVID-19. You click on it, and it takes you into our vaccine site. Everything that you would ever want to know about vaccine is there, as well as the steps in order to sign up for the vaccine. I can tell you right now, if you go on there today, I mean, there's open slots for next Friday at Little Rock, North Little Rock, Conway, and Fort Smith. So there's 4 different sites that you can click on and schedule your time for the vaccine if you are of the criteria that's eligible for it right now. If you are not 70 plus years old and you're not eligible for it right now, what I would encourage you to do is still go onto the website, go ahead, because you have to create what's called a MyChart account. It's very quick, it's pretty simple. But once you create that account, that is going to be the tool that you go into. It's an app on your phone. You open it up, and you can schedule your appointment as soon as the vaccine is made available for your population. So Regardless of age or criteria right now, I'd encourage everyone to go create that account just so that when it is your turn, you can very quickly go on there and schedule yourself. This is just a picture. Today we're actually we're doing 400. I think we have scheduled 70 plus year olds through our vaccine clinic here at the hospital. So this is a conference room that we've converted into our vaccine clinic. Each one of these little stations is a vaccinator that's sitting there. So we're running 6 people that are doing vaccinations at a time, and we're able to do about 100 people an hour is how many we can vaccinate in an hour. So we were planning today, we actually scaled today way back, we would have had close to 800, but due to the weather, we cut it off, and we gave folks the option to reschedule for next week, but for whatever reason, we had very few takers. So, and folks are showing up today to get their vaccine. So I think they're ready. They didn't want to wait. They didn't want to push it off one more week. And so we've kept it open and it's running today. And that concludes my presentation on the COVID vaccine. I'm happy to talk about anything else, answer any questions about COVID, but if you have any other questions about Baptist Health or I'd be happy to comment or give you any feedback on that as well.
Hey, Tim, what about the second shot? You know, they schedule you for the second shot. Is there anything you have to go online and redo for the second shot, or just show up?
No, sir. So when you get your first shot, we actually go ahead and schedule you your date and time before you leave. So when you're leaving and checking out after you get your first dose vaccine, you'll walk out with an appointment card for your second dose.
Thank you.
Tim?
I've got mine. I just wanted to make sure.
Hi, Tim. I just want to thank you and Conway Regional, everybody partnering with this effort. I know the lack of vaccines has been the biggest impediment. You know, I've been getting a number of questions about, and have talked with Ty Ledbetter and others about, are we reaching out, especially in more rural communities and in minority communities, you know, especially a lot of the elderly people who aren't really comfortable with going out and processing things online. And so it's kind of 2 questions, you know, kind of that outreach. And I know that Cornell Maltby is doing some things and some others with that group, but also, is there a place to kind of look at the data with the demographics to see, you know, I hear it anecdotally, but I don't know that it's true. And so kind of where could I go find that, you know, the older people are getting it based on the population? That's a lot of questions there, sorry.
Yeah, no, all good questions. So, so we do track demographical information and we upload that to the state. I haven't seen anywhere where they've released that yet. I mean, they're saying how many doses are done, but the state health department has it, and we have it just on the doses that we've given. All at Baptist Health, we've done roughly 35,000 vaccines so far. So that's total throughout the entire system. So I have the data and the demographics on them, and then I have the data and demographics specific to Conway of what we've done. You know, it's really tough to kind of know, you know, how we're touching some of these rural areas. You know, local pharmacies in those areas do have vaccine, and they're dosing those same populations as well. So I don't get their information, nor do I get the information from the retail pharmacies around. But I mean, I guess it's kind of hard. It's hard to know that. You know, the only gauge that we have is if we're still filling up slots with 70-plus-year-olds within days of posting the appointments, then that tells me that we still have a long ways to go to make it through that remaining population. You know, I'm concerned there are individuals, because so much of this, as you've heard from me, it's moved electronically, and if you're not have access to computer, internet, and not savvy to be able to go on and do these things, it is you are at a disadvantage to getting the vaccine at this point. So Cornell has been great. He reached out and emailed, I think, 35 different contacts that he had to try to get the word out. We specifically gave him about a day's heads up before we opened it for everyone else, just trying to touch and make sure we got to folks. We also have been using the church network. So we've got a network of about 100 churches that we've been pushing it out, and then they have their own, communication and distribution paths. So we've been leaning on the churches fairly heavily to help get the word out as well.
Thank you, Tim.
I think one of the things as well, I know I contacted 4 pharmacies and got scheduled for one of them for my shots. And then they called me and said, hey, we're going to reschedule you. Went out pretty far. And then I went to Baptist and got my first shot. But the key thing is I was injured and I couldn't get on. I can't type on the computer, and that was a drawback for me. But the people at the hospital really helped me out. But my doctor contacted me to make sure he was checking or she was checking all of the 70-year-olds and above, which I just fit in.
Yeah, one other thing I've heard, I need to touch base and learn a little bit more about it. But when I was talking to a few individuals that were coming through our vaccine clinic last week, some of them mentioned that I guess at CVS, the pharmacy here, they had a nursing student. I'm not sure if it was UCA or one of the other nursing schools, had a booth set up and was actually signing people up for the vaccine. They had a computer set up and they were helping them create MyChart accounts and getting them set up through the Baptist process, as well as I think they had, a few other avenues as well. So, that's probably a great way. We probably do need to think about having individuals strategically around in rural communities and some others to help folks get scheduled for the vaccine.
Tim,
Thank you. Go ahead, Roger.
I've been trying to help an elderly person get on or get a COVID, and who's not very computer savvy. And I got on your site. I finally got on again now on my iPhone, but that wasn't easy to do. And because you have to get on a code sent to you, and it's very cumbersome. There ought to be a better way of doing things than what we're doing. I'm going to try to complete this for the person if I can. I thought you had to have your social security number, but I see that does not have a red dot on it. So I guess I can do it without his social security number.
Yeah, the code getting sent to you is so you are creating a health account. So within MyChart, and that code coming back to you is just validating, so that someone doesn't create something in your name and without you being able to validate it through an email or a text message. So
yeah.
But yes, that is just for security purposes, because you are creating a health account, because this MyChart is that is our electronic health record. I mean, that's how we communicate everything to all of our patients, whether it's your lab results or x-ray results, or you want to schedule an appointment with your primary care doc or look at your after visit summary. It was just, that is one of the challenges with, I think, this vaccination process is all of the data that we have to send all this to the Department of Health. So they want to know all this demographical information. We have to have all the consents. We have to have all of that electronically sent. And in order to do thousands of people in a week at a single site, it's got to be automated, because early on when we were getting, I think the first dose, we just got a few hundred doses. We did those manually, and it did take a significant amount of time. We had to scan all the paper records in and upload them to the Department of Health, and it was a lot of manpower to do that. There's no way, if we don't have it automated, or if the Department of Health continues to require the amount of information we're having to upload, which I expect they will. That's really the biggest burden of why it has to be electronically. I think to your point, we probably can make it a little easier and simpler. It's quite a few steps. Some of this is being built in, as you can imagine, in very short time frames. And it is getting better, I think, week to week. because we're making a lot of tweaks and changes to it. But if you do have issues, there is a help number that you should be able to call. It's on the website that someone can kind of walk you through to get it set up, or they can even do it for you if you're having issues.
Well, I'm just afraid there's going to be a lot of people who don't have computer access or somebody to help them for them are not going to get shots because it's just too cumbersome or too difficult. There ought to be some place where they can call and somebody do this for them. I guess it may be a center set up. I don't know.
Yes, sir. No, that's your points are very valid, and those are things that we're kind of figuring out week to week. We're also trying to learn from the Department of Health if hospitals are going to be in the vaccination business long term. So I don't think the Department of Health really has solidified that hospitals are going to be the site. We're lobbying for that we are, but I can tell you 2 months ago the plan was retail pharmacies were going to be the avenue by which everyone would get vaccinated. Only because hospitals have kind of waved their hand and said, well, we've got more resources, we can do a lot more in a single day, just because of our size and resources we have available is the reason we're in it. But I mean, they've changed. The Department of Health is tweaking their plan week to week on where the vaccines goes, because some of the retail pharmacies are doing a really good job, and some of them have reached out to us and said, hey, there's no way I can give 100 shots in a week. It's just that's too many. We don't have the resources. We've got 4 employees and can't do it. Can y'all help us? Can you take our doses? So it is we're learning that each week that goes by. I think how to be better at it, and I think you'll see all aspects of it should continue to get better each week that we do it.
Tim, thank you. And a couple questions. If someone isn't able to make their appointment, or someone's for whatever reasons, do you have an on-call list for those that are signed up, and then y'all would call them in to say, we don't want to waste any of the vaccine serum, and then they're able to come in so that you don't lose that? And then secondly, what are you hearing for the vaccines to be approved for youth 16 and under? Since the emergency use was, the testing weren't for, had kids involved, but when will that be coming out? It's great that the teachers are, but the kids, if to be in the schools too, that would make a huge difference as well. And I know they're not quite approved yet, but what do you hear when that's coming?
Yeah, so no word on when they're planning on lowering it into that age range. And honestly, I think it's going to be quite a while, just because individuals under 16, they just don't get sick. A lot of them are asymptomatic, so it's just the virus just does not seem to impact them the way that it does older population with underlying comorbidities. And just to give you kind of a sense of where we're at as for the state. So in the group of 70 plus and educators and daycare workers that are currently in the 1B, that's roughly 400,000 people in Arkansas. So if you think 400,000 people are eligible for the vaccine, have been eligible the last month or so, the state's getting, you saw my numbers, 19,000 and 17,000. So we're roughly getting 36,000 doses a week. So we know that not everyone is taking the vaccine, even if they're eligible. We're seeing about a 55 to 60% acceptance rate is what we're seeing. So you take that math and that breaks down to a little over 200,000. We should be getting fairly close at 35,000 doses a week. And we've been doing it now for a month or so of getting that on this current population. I think we're getting close to the governor here in the very near future, opening up to the next group. But I don't see it being 16 for that group. I think more they're still studying that. I haven't even heard if they've expanded the trial to include 16 and under, to even start, researching that.
Thank you. And then back to the question on, do you have an on-call list for those that might be waiting and others miss their appointment?
Yeah. So our practice is we give folks an hour. So one hour, once 1 hour passes past your appointment, and we will call you to see, you're on your way, is typically our time frame. Once we pull a vial out of the ultra cold freezer, and it takes about 30 minutes for it to defrost and warm, then it can be diluted, and we start drawing the doses off of that. Once we draw a dose off of it, it has 6 hours before that dose goes bad. So we don't get too far ahead of our vaccine clinic. So we're not going to, if we're doing 400 people today, we didn't pull 400 doses out this morning. We pulled 100 out, and we started there, and we'll kind of keep track with how the no-shows or cancellations go throughout the day. So we aren't in a situation where we're going to have more than, I'd say, 6 to 12 doses sitting by the end of the day that potentially could be, ones that are on the clock. And to answer your question, we do. So what we'll typically do is reach out to the next week's list. So whoever is on the list to be vaccinated, like next Friday, I think we've already got a few hundred on the list for next Friday. We would just reach out to that list and start calling those individuals to see if somebody wanted to come on in today.
Thank you.
Hey, Tim, what's the recommendation for the vaccine for people who've already had COVID?
Yes. So first and foremost, I would say speak with your primary care physician to get, guidance. I've got a business degree, not a medical degree, so I wouldn't listen.
Well, but what's the hospital's recommendations?
We've been, most of our employees, I think they're advising them to wait. I can't remember exactly the day in my mind, but I want to say it was like 30 to 90 days, somewhere in there, after you've had it. But they are recommending individuals that have had COVID to get the vaccine, but there is a kind of a delay period after it. But I can't think of exactly what that number is off the top of my head.
Okay. Well, and I've had it, and right now, why? And I've had it recently. Why take a vaccine when somebody else can get it right now if I've got a few more months of immunity from it? So, but they are saying at some point that it'd be good to do that. Okay.
Absolutely. Yeah. Because I'll tell you, we haven't had a lot, but we have around 13,000 employees. So, so we've got a lot of examples of individuals that have gotten it over, from an employee standpoint. We've had a handful of employees that have gotten it twice. So, I would definitely recommend to get it when you're eligible.
Okay.
Tim, what would happen in the scenario where someone contracted COVID between shots 1 and 2?
Yeah, so we had that happen to one of our employees. And so you don't have to get your second shot at 21 days. So the Pfizer dose is you get the dose, the second dose is 21 days later. The Moderna dose is 28 days later. So it does not have to be within that. They do recommend within 6 weeks that you would get your second dose. They don't want you to go, beyond that, but 6 weeks is and under, down to that 3 weeks or 4 weeks would be ideal. And after the first dose, on the Moderna, the Pfizer, your coverage is, you get your first dose, and I think after 7 to 14 days, it's up in the 80% range. So you have very high coverage just after the first dose.
And does the testing clinic intend to be open tomorrow if the weather's bad?
So we close today, but we do plan to be open tomorrow.
Any other questions for Tim? All right, thanks so much for visiting with us today. That was very informative and answered a lot of what I didn't know about COVID, even though I thought I'd heard it all. So I appreciate that. I'm going to post the link of today's talk. So if anyone knows of someone who needs to hear this, who has some reservations about the vaccine, I encourage you to share it from the Rotary page. I look forward to seeing everyone next week, and reach out if you need anything. And I'll give everyone a chance to say any last minute announcements if you've thought of one. All right, all is quiet. Everyone have a great week. Stay safe out there and stay warm.
Thank you.